You're watching Baptist Health's Resource Live, where our respected experts bring you timely and practical health and wellness information to improve your family's way of life. We're healthcare that cares. This is Resource Live.
Integrative medicine is healing-oriented medicine that takes account of the whole person, including all aspects of the lifestyle. Hello, everyone. I'm Dr. Jonathan Fialco, Chief Population Health Officer at Baptist Health South Florida, coming to you live from the Baptist Health Newsroom. People suffering from cancer, persistent pain, chronic fatigue, and many other conditions are using therapies beyond the traditional ones being offered to better manage their symptoms and improve their quality of life. Examples of common practices include animal-assisted therapy, music therapy, and meditation. We have with us today some experts and partners of the Baptist Health family to talk about medicine beyond the traditional therapies and how healing the whole person helps speed up the recovery process. I'd like to welcome Dr. Beatrice Currier, Medical Director of the Cancer Patient Support Center at Baptist Health's Miami Cancer Institute. Welcome, Beatrice.
Thank you. Good to be here.
T. Squire, Community Garden Manager with the Grow to Heal program at Baptist Health's Homestead Hospital. Pleasure to have you here, T.
Thank you for inviting me.
And Wally Majors, Dog Therapy Volunteer at Baptist Health's Bethesda Hospital East. Thanks for being with us today, Wally.
Good afternoon.
Great. It's a pleasure to have you all here today. Before we dive into today's subjects, I want to remind our visitors to send in your questions and comments throughout the segment. We're here for you and happy to answer any questions you may have. Beatrice, let's dive into these interesting topics that might seem a little bit outside the spectrum of how we generally provide care to patients, but certainly really important and fascinating in both their action and benefit. So let's start with talking about arts in medicine. Arts play an integral role in healing and promoting the well-being of patients and caregivers and staff in those healthcare settings. How have you seen music, art, reading, dance, whatever the spectrum is, how have you seen these arts improve the health of your patients?
Well, it's had a substantial positive impact on our patients. The Arts in Medicine program at Miami Cancer Institute is our most recent expansion of our medicine evidence-based practices for our patients. And it has been quite transformative in terms of the patient experience as well as the quality of life. And we have now engaged over 6,000 patients in the last months since the program has been launched. And what we have found is that there's significant reduction in not just emotional symptoms such as anxiety or depression or fear, but also physical symptoms. Their perception of pain significantly reduces, as well as nausea while they're undergoing their chemotherapy infusions. So it's been very good for them, and not just the healthcare providers and the caregivers who are there present with them. So the patient testimonials have been very moving and inspirational as well.
It's just fascinating both to come up with the concept and implement it and see the benefits and the outcomes that you're describing. Tell us a little bit of detail about what the programs actually look like. What is that patient experience? Are patients selected for it? They choose to participate on their own? How do you identify which arts would be beneficial to a patient? Tell a little bit more about it. It just again, it fascinates me.
So we have brought in seven outstanding professional artists, 2 that are visual artists and 5 that are performing artists, predominantly musicians and a vocalist. And we have positioned it in such a way throughout the Institute that it has become an immersive art experience. And the objective is to engage the patients in the arts, whether it's visual or performing arts. And these artists are positioned in the lobbies, in the waiting areas of the clinic, as well as in the treatment areas in the infusion center. And so patients have the opportunity to engage in any of these arts as they are walking through the building, or if they're in the waiting rooms, they are invited to either actively participate by creating artwork or singing along with the musicians, or they can passively engage. But either way, we are surveying these patients and they are recording lower levels of anxiety, fear, pain, nausea. And the research has substantiated that. There's now compelling research showing that we can actually reduce blood pressure, heart rate, respiratory rate by having the patients either passively engage or actively engage in the arts. Patients can also request an individual consultation if they choose not to engage in the lobby areas. Once they're in the infusion areas, they'll ask the nurses, could I please have an artist or a musician come to my chair side during my chemotherapy? So to give you an idea, approximately 700 patients are requesting monthly consultations with the artist, and over 1,500 are participating in the arts in the waiting areas. So it's been a very robust, exciting time for us the last 3 months.
So you have subjective findings, which is part of the goal of patient comfort, as you say, objective findings of physiological improvements of things that would other indicate psychological and physical stress. And now you have, I'm sure, a backlog of people who would benefit from this, and you're trying to keep up the resources to support it. What other forms of integrative medicine have you seen have been applied in helping patients through the illnesses? The arts program clearly being a highlight, but what else? What other forms have you seen helpful?
We provide acupuncture here, which has probably the strongest bed of literature to support its efficacy in treating cancer-related pain, cancer-related side effects, such as the dry mouth that may develop in some patients who undergo radiation to the head and neck area. Also very effective for treating chemotherapy-related nausea. So acupuncture services are here. We also train our patients in meditation mindfulness, which helps an entire array of symptom complexes throughout their cancer journey. And we also offer an 8-week workshop to train our patients to empower them to utilize meditation mindfulness. We also have oncology massage therapy. We offer yoga and Tai Chi 3 times per week, right now virtually. And we also have a strong exercise, nutrition, and sleep clinic to help target those lifestyle medicine practices that are so important for maintaining our health.
So is it fair to say, and certainly correct me if I'm wrong, you have certain services on site, you're able to provide certain services and education virtually, and then some of it you're training the patient to actually continue with these integrative care models at home on their own. Is that appropriate?
Yes.
Okay. Wow, that's just, again, very exciting and very out of the box thinking, and most importantly, you have the outcomes to show the benefit of these initiatives. We'll turn it over to T. Squire. We can move on to food at this point. T, an increasing number of medical studies conclude that a diet rich with fruits and vegetables is key to preventing and managing chronic health conditions, certainly something in the cardiovascular world we deal with as well. So in a sense, food is medicine.
Absolutely.
How does food heal? Give us some examples of your perspective, or start with your perspective and then give us some examples about the food as medicine approach towards disease management.
Well, first and foremost, it's a great tool for preventative health. So if you can prevent the disease or illness to rear its face, then you don't really have a problem, or you don't have as big of a problem. And you can do that with a healthy lifestyle, which starts with the food you consume. So the cleaner, the fresher, the more nutritious the food is, the more benefit you will have in your health and wellness.
So how, again, that's, we'll use the term 800-pound gorilla in our society. What is healthy food? How do we provide access to healthy food for people who may not? Healthier food might be a little more expensive than less nutritional food. So with that premise, what do you see as kind of specific types of foods or qualities of foods that might help in terms of, again, both prevention and managing chronic disease? And then we'll talk a little bit about your program at Homestead Hospital.
Well, first of all, I spent a lot of time debunking the myth that healthy food is extremely expensive or time consuming to prepare. It's about going back to basic skills, life skills, and learning those skills and doing some planning. But having access is definitely key. education on the benefits. I mean, all real whole foods have more nutritional value, and fruits and vegetables in particular have a lot of anti-inflammatory qualities, which in itself can fend off diseases. And processed foods, heavily processed foods, generally does not have any, very minimal nutritional value. And more importantly, all of these synthetic ingredients cause inflammation, which then attracts diseases. So very important to be able to make those choices.
When we talk about obesity in and of itself, but certainly the kind of foods that tend to lead to a person to start storing energy, cancer, heart disease, many chronic diseases are tied towards that diet. And I always tell my patients to shop the outside rims of a supermarket. Don't go down the aisles, because that's where you're going to find, the freshest, most natural foods, less processed foods to some degree. Is there any thoughts towards that?
Oh, you couldn't be more spot on. It is really crucial. And I would say also not to buy into all of the commercials and the marketing involved with all of those processed foods. Learn to enjoy the beauty and bounty that nature has given us. These things that are healthy for you are also very delicious and joyful. And I really encourage people to explore more delicious foods.
Again, that message resonates for those that listen to our podcasts and other resource lives. And again, these are certain things we say. And one of the aspects I always say is, as well as, if a food in a box makes a health claim, run away from it. don't eat the food, because
Yes.
it's going to tell you it's making you healthy.
And if it contains ingredients that you can't pronounce or sound as if they've been created in a laboratory, even more reason to run from it.
Fantastic. Well, now tell us a little bit about the Grow to Heal program at Homestead Hospital. It's the only hospital-based feeding garden in the state. How do you incorporate the food you grow in your garden with the patients at the hospital?
Well, we harvest at Homestead on average 5,000 to 8,000 pounds of produce annually. And I harvest and I take it directly into our kitchen, where our chef incorporates it into all the patient and cafeteria meals. So it's fairly streamlined. I mean, we really can't be providing fresher produce in season to our patients. And also, you may not know, but we actually have Grow to Heal gardens at 4 hospitals within Baptist. It of course started at Homestead Hospital almost 7 years ago. And then we started one at West Kendall, South Miami, and Doctors Hospital. So, and we hope to expand to other facilities in some form or fashion as well.
Phenomenal. Are the patients made aware of that? Is it patients and employees first? And is there a designation that these foods were grown at the local garden?
We're working on that. It's complicated, and there's lots of layers. We're working on it. First and foremost, educating our staff is the key part of the component, and really we're educating the community as well. I mean, one of the things I do at Grow to Heal is provide field trips for K through 12 students, as well as other communities, parts of the community, garden clubs or the Girl Scouts, Boy Scouts, that type of thing. So during those field trips is when we really have an opportunity to make an impact on the future generations, and teaching them how to make these better choices, and teaching them about what grows locally and how to better be connected to their community.
So have you seen other impact by these efforts, Homestead in particular, or even at the hospitals? I mean, it's great. It's rewarding. The education process is only going to help both short and long term to the patients and employees and families. Any other areas of impact that you're able to share with us?
Well, we do a lot of workshops, or we did pre-COVID in terms of working with diabetic or patients with heart disease and that sort of thing, to really help get them back on track. So sort of two layers of the education. One is preventative, of course. So you're preventing the disease. And then once the patients have actually been diagnosed, then we work very closely to try to give them tools, real tools to make better choices and change their lifestyle, make meaningful lifestyle changes.
Wonderful, wonderful. Well, from the arts to food, now to animals. Wally, tell us a little bit about how the pet therapy works. What kind of impact do animals have on patients who are admitted to the hospital?
Well, it works from the standpoint that we come to the hospital and there will be a list available of patients that have requested a visit from the animal. And we then certainly go into those patients' rooms and spend time with them. But we also take time to just simply walk around the hallways, because we found that not only the patients enjoy the company of the dog, but in many cases, the nurses are the ones who are even happier to have that moment of that positive distraction. And that ultimately is, I think, the biggest benefit that not only the patients, but also the staff at the hospital achieve by seeing the dog, is that ability to have an opportunity to think about something else other than the challenge that they're dealing with by being at the hospital. And it's definitely something very, very magical that happens. There's an abundance of data that provides a lot of proof in terms of the objective situations that occur when an animal enters the room. But having add the personal experiences that we have had in the time that we spend not only at the hospital, but also visiting some local schools, for example, that have programs for children with autism, for example, or various disabilities. The impact is very, very tangible from the standpoint that you have really remarkable interactions with these individuals, whereby you can tell when you walk into a room or when you walk into a classroom, where you can tell that there's just not necessarily a very positive environment from the standpoint that people are not necessarily happy to be in a hospital. But the minute the animal walks in, it really changes the whole attitude of the people in there, and really brings a little bit of sunshine to the day, albeit maybe for 10, 15 minutes or so. But I can tell you some of the experiences that we've had with my dog Boone at the hospital has just simply been amazing, and something that we will cherish for many, many years, because it's just hard to describe the impact that the animal has unless you're actually there. But it's truly something that has been an incredibly rewarding experience, and we just look forward to being able to do it for many, many more years.
Quite frankly, I'm wondering what took so long. As a pet lover, a dog lover, and certainly personal experiences coming home after a crazy day and the dogs put their head in your lap and the neurochemicals in the brain start relaxing you, and they've shown it lowers blood pressure, and people with diseases do better at home, and people live longer if they have pets. So why not bring that into that hyperacute, tense, stressful space? And through the work you're doing, you're seeing that kind of positive impact on the patients, but the people around it as well. I used to bring my dogs to my clinical office in the past, and there'd always be the concern, well, people love it, and the patients loved it. They would actually ask, can I see him again on a dog day?
Yes.
So hopefully you'll be able to expand your efforts, and others.
Absolutely.
So enlightened. Tell us a little bit though about the difference, for example, between a pet therapy animal and service animals. Can you talk a little bit about the difference so people don't get confused?
Yes, and I really appreciate having this opportunity, because unfortunately, through my experience, and I think it's fairly common, that people have really taken advantage of the fact that, quite honestly, you can go and get a vest online and you can basically have what people think is a service dog. But a service dog is an incredible being from the standpoint that first of all, they're covered by federal law and have the right to go anywhere that the individual who uses the dog needs to be. And as such, the service dog is being trained to mitigate whatever challenges that individual may have. And consequently, they are allowed to go anywhere and have the right and the ability to, again, do whatever that person needs to get through the daily life. So one of the most common, not necessarily common, but very visual service dog is a person who may be visually impaired. And as you can imagine, that dog not only has to lead that person around in environments that can be very challenging, elevators, high traffic areas, but that dog also has to learn that if he sees a squirrel or a cat, he can't react. Or for example, even if he has to go and use the restroom, that dog can only do it when he's allowed to do it. So a service dog has perhaps the highest level of training that anyone can even imagine, hundreds of hours of training. Whereas a therapy dog simply has to have really good temperament and has to be very comfortable in environments whereby people may want to touch and hug them and interact with them. Whereas a service dog, as most people should know, when a dog is working, they should never be disturbed. And oftentimes you'll find that people, when they see a dog, they want to pet and talk to the dog, but when a service dog is working, they should never, ever be disturbed. Because if you do that, that could really cause a lot of problems for that person that needs the aid of that animal. So it's unfortunately, a lot of people do make things harder because they don't understand how important that is when that a service dog is working. But it's important that they realize that when the service dog is working, he's there for a very important reason. And by not understanding the difference between therapy and service dog, you can really do a lot of harm. And so whenever we have an opportunity, for example, my dog Boone and I do spend a lot of time at local schools meeting with children. We try to educate them and the teachers to understand that there is a big, big difference. And then what they do realize that this dog is working and assisting somebody, they should never be disturbed because he's there to really do some very, very important tasks. And by disturbing them, you can really cause a lot of problems.
I think that's a great public service explanation. And the way I look at it, and you feel free to correct me, is service animals at a very high level of working, and pet therapy animals are there to bring love. Exactly. And I think there is an important role for both.
Yes.
So folks, to our viewers, don't be surprised if you're at a Baptist facility and you see someone playing the guitar or dancing, or you have natural foods that are grown locally, or you see animals in their proper place. That's the integrative approach we're taking within the Baptist health system towards patient care and the support of patients in need. Let's take some questions now that are coming in from the audience in the few minutes we have left. And again, I really appreciate both the work and the explanation from our guests. To Dr. Curry, to Beatrice. Question is, for the MCI Arts program, is it included for patients with autoimmune disorders or only for cancer patients?
Right now, the program is structured strictly for cancer patients who are in their active treatment or in their survivorship surveillance care.
But certainly we're well past proof of concept, and we can look at expanding these types of resources across a spectrum of diseases. So again, the groundwork's been laid, as we may say. Also, Beatrice, how can MCI Support Center help newly diagnosed cancer patients? Do you want to talk a little bit about those robust services at the support center?
Well, sure. At the support center, we have a constellation of multiple specialties, including psychiatrists, neuropsychologists, our cancer rehab physicians, our entire nutrition program. All of our integrative medicine program is within our support center to help the patients along the way, as well as our survivorship care program, which really includes a large, complex array of issues that may arise in the survivorship mode that we're able to handle here on site. So it's really about supporting the patient with whatever needs they have along the way in their cancer journey, and making sure that we're also helping the caregiver, who can also, we know that cancer impacts the entire family, and we want to make sure that the caregiver is able to cope with this diagnosis, because they play a pivotal role in supporting the patient as well.
Thank you. For Wally, how can someone become a pet therapist? What background do you need to have?
Really, it's something that's readily available in terms of, as long as you have a dog that's well-tempered and will follow your commands, basically. There are several agencies that you can find online that could provide you the appropriate testing that would then give you the qualifications that are needed to enter into facilities such as hospitals and schools and assisted living facilities. So I would just refer people to go online, find a local agency. One very common one is the AKC, the American Kennel Association. I believe it's AKC, but it's American Kennel Association, and they provide a canine good citizen followed by a therapy dog testing program. And primarily the dog has to show that he has the proper temperament and he's able to follow basic commands, whereby obviously if you're going into a situation like the hospital, if you tell the dog to sit, he needs to sit. And if he needs to tell the dog to lay, he will lay and respond to your commands, and also be well-behaved and comfortable in that environment. So I would just suggest people to get online. There are a lot of local agencies that provide this service. And also you can find a lot of great training tips on online. And I'm sorry, my cat's trying to get online here too, but that will show you just some basic commands that are necessary for the dog to master and show that they're competent enough to, again, be comfortable in an environment where they're going to come in contact with a lot of people and be comfortable with that.
Thank you. For T, certain tropical fruits have a lot of sugar. Would they still be considered healthy for preventive and for anti-inflammatory properties?
Oh, that's a common loaded question. Yes, lots of sugars. So you have to keep in mind, if you're diabetic, you have to balance your sugar and carbs. So that means enjoy your mango or other tropical fruit. Then you have to maybe not have any white rice or potatoes or the pasta. So it's all about balance. So you kind of pick your battles, I suppose you could say, and understanding, just really understanding the full picture of what your full day's intake is.
Your total body intake, not just the particular item.
Right, exactly.
Great answer. Can I, not me personally, though we can always talk about it, but to T, can I volunteer at the Grow to Heal program?
Absolutely. I do take volunteers. Generally Monday through Friday. You just need to contact me. So you can email me. Do you want me to give my email?
I think we can, or possibly we can put it in the resource notes.
Okay.
So
Yes,
maybe
that would be
we
best.
can do that as well. But that'd be wonderful. Last question goes to Beatrice. How does someone get into integrative medicine as a career?
Oh, so, well, fortunately nowadays, I think 30 years ago, this wasn't emphasized much in the curriculum in medical school. That's now changing. And I think that most people that go into medicine are now learning a lot more about the science behind integrative medicine. There are also other tracks that you can take that's called lifestyle medicine. So anyone with a medical background can look into added credentials in that arena. But for the most part, I think integrative medicine that's evidence-based is now becoming much more mainstream in complementing traditional medicine. So it really varies in terms of what your background is, but I would encourage people to look at the Integrative Medicine Society webpage, or lifestyle medicine, or mind-body medicine. These are all the semantics surrounding this type of medical practices that now recognize the impact that thoughts, feelings, behaviors, and lifestyle has on your overall physical well-being.
Guys, this has been a great conversation. We have about a minute left. So just to wrap up, I'll go to each of you. Loaded question, but you can feel free to add a little dialogue to it in the amount of time we have. Integrative medicine, do you see this as something expanding across the general healthcare system? Beatrice?
Absolutely. I mean, we've seen it over the last 20 years. It's now becoming much more mainstream because they now are having the research built into it to really substantiate its efficacy in certain types of modalities and certain types of disease states. And I think we are now learning that we need to treat the whole patient, not just the disease. And so I really do think this will continue to flourish in the world of conventional medicine.
T?
Well, for what I do, absolutely, because it's all about food and what you put in your body. That's the key, the foundation to your health and wellness.
And Wally, my man?
Yeah, I would just say, even just recently, there was something on the local news about the Palm Beach County Sheriff's Office bringing in 4 therapy dogs to work not only with victims of crime, especially young victims, but also with their own officers, whereby, again, just having a dog around helps set people at ease, puts a smile on their face, and helps them get through very difficult situations.
Thank you guys all for sharing your insights with our audience. Remember, viewers, you can connect with us on our social media channels. That's Facebook, Instagram, Twitter, and LinkedIn. And check out the resource blog for the latest news at baptisthealth.net/news. You'll find a link there to all the episodes of the Baptist Health Talk podcast as well. On behalf of everyone at Baptist Health, we ask you to please stay safe and say yes to the COVID-19 vaccine. Thank you.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Resource Live is brought to you by Baptist Health South Florida, healthcare that cares.